Bismillahirrahmanirrahim. Once again, welcome to my new lecture, dear students and my viewers. Today we will discuss about the anti-ulcer drugs. As we have already talked about in our previous lectures, the different drugs which are acting on your gastrointestinal tracts. But today lecture is about anti-ulcer drugs and how these anti-ulcer drugs can acting on the GI tract. As we know that stomach comprises of several different cells, and these cells are different type. The first one is parietal cells. Parietal cells are those cells which are responsible to secrete hydrochloric acid, HCl. Histamines, which are released by the basophils and mast cells, so it can stimulate the parietal cells to secrete the hydrochloric acids. So I am talking about the stomach, the different type of cells which are present in your stomach. So the first one is parietal cells. The parietal cells, these are the specialized cells which are responsible for the secretion of HCl, hydrochloric acids. How these hydrochloric acid they are secreted? So as we know that histamines, which are released by the basophils and mast cells, and these histamines stimulate the parietal cells to secrete the hydrochloric acids. While the second one is chief cells. Chief cells, they are also responsible for the secretion of pepsinogens. As we know that pepsinogen is the inactive form of pepsin. So the parietal cells secrete hydrochloric acids, while the chief cells it secrete pepsinogens. And these pepsinogens then it is converted into pepsins in acidic environment which can digest the proteins. So the chief cells, they are usually responsible for the secretion of pepsinogens, and these pepsinogens, this is the inactive form of the pepsins, and then they are converted into pepsins in acidic environment which have the capability to digest proteins. While the third one is gastrin producing cells. The gastrins producing cells, it secrete the gastrins, and these gastrins it can stimulate or increase the acid productions. So moreover, I would like to say that stomach comprises of several different cells like parietal cells, like chief cells and gastric producing cells. So the gastric producing cells, they are responsible to secrete the gastrins, and these gastrin stimulates increase the acid productions. While the fourth one is mucus producing cells. The mucus producing cells, or the mucus forms a protective layers over the stomach internal surface. There are also different type of layers like mucosa, submucosa and serosa. So the mucus producing cells, they are responsible for the production of mucus, which form a protective layers over the stomachs, especially in the internal surfaces. The gastric mucosal barriers, this is a thick viscous mucosal layer which provide the barriers between the mucosal linings and the gastric secretions against the corrosive materials. Before studying pharmacology, we should know about the origin of the disease, about its pathology and pathophysiology as well as. Now we are going to treat the peptic ulcer disease. So peptic ulcer disease are in simple word that is called PUD. So peptic ulcer disease, this disease is due to the effects of pepsin and HCl at the epithelial surface of the gastrointestinal tract. So it is clear, we have already discussed that there are 4 different type of cells, like parietal cells. So parietal cells, they are responsible for the secretion of what? For the secretion of hydrochloric acids. And this peptic ulcer disease, the main cause, the main etiology of the peptic ulcer disease is due to the production of pepsins and HCl hydrochloric acids, especially at the epithelial surface of the gastrointestinal tract. Whenever there is imbalance between the defensive and the aggressive factors, so it increases the probability of the ulcer development. Now, what are the aggressive factors and defensive factors? So defensive factors, actually these are the gastric mucosal barriers. The gastric mucosal barriers and the secretion of bicarbonate ions, these are defensive factors. One is offensive, or which are also called aggressive factors or aggravating factors. That is in the form of H. pylori infection, Helicobacter pylori infection, which causes damage to the mucus coatings. In aggressive factors, sometimes we are using drugs like NSAID, non-steroidal anti-inflammatory drugs, including aspirins, or the mechanical disturbance, hypersecretion of the acids, pepsin, or defective sphincters. For example, let's suppose we are using spicy food. So spicy food is also one of the aggressive factor which is responsible for the peptic ulcer disease. Stress is also another aggravating factor which is responsible for the peptic ulcer disease. And especially during pregnancy, so pregnancy is also one of the leading cause which is also responsible for the peptic ulcer disease. And this problem is very common all over the world, not only in Pakistan. So it depends upon on your diet, that what type of diet you are taking. After that, what are the common sites of peptic ulcers? I mean that what are the common sites of the peptic ulcers? That may be duodenal ulcer, that may be gastric ulcers, and that may be peptic ulcers. So in peptic ulcer disease, duodenal ulcer, which is the most common form of ulcers. One ulcer is called duodenal ulcers, the ulcer which is produced in the duodenums. Gastric ulcers, ulcer in the gastric glands. Pyloric sphincterums and peptic ulcers. As we know that all these there are different type of ulcers. So the common sites of the peptic ulcers, that is cardiac sphincters, that is pyloric sphincter regions, duodenal ulcer, gastric ulcer, esophageal ulcers, and cardiac sphincter, and many and more. So different areas they are affected, especially the different parts of your stomach they are affected. Now question is, what are the name of those drugs which decrease the gastric acid secretions? They include, the first one is acid secretion inhibitors. These are the drugs which are responsible to reduce or stop the gastric acid secretions. So what actually happens, what actually occur whenever there is hyperacidity or whenever there is increase the secretion of hydrochloric acid in your stomach. So the first one is, they include the acid secretion inhibitors. The second one is proton pump inhibitors, PPI. The third one is locally acting antacids. while the fourth one is gastric protectants, and those that eradicates the H. pylori infection, which is very common. So I mean, different drugs have different mechanism of action, that how the drug can reach to its target sites. So this is, I just highlight the name of those drugs like acid secretion inhibitors, PPI, proton pump inhibitors, locally acting antacids, and gastric protectants. Inshallah, in my next lecture, we will discuss about the acid secretion inhibitors and what are the name of those drugs which are included in these categories, like histamine H2 receptor blocker or H2 receptor antagonist. So inshallah, I will deliver inshallah a special lecture on the acid secretion inhibitors. Thank you so much for watching my lecture. So if you have any question regarding my lecture, so I am available for any kind of services. Thank you.